today, just to introduce myself quickly, I'm Danielle Pollock, and I'm with the Evidence-Based Healthcare Research Division, which is a new division of JBI with Zach Munn. And I'm here with the absolutely wonderful Associate Professor Andrea Tricco. Andrea, would you like to introduce yourself a little bit more?
I think you covered it well. The only thing I would say is that feeling is mutual, and I think you're brilliant and fantastic to work with as well.
Oh, the warm fuzzies today. Today, Andrew and I are going to be talking about stakeholder engagement in evidence synthesis. We know that this is becoming a really pertinent issue within the field of evidence synthesis. There's been a lot of work with this in primary research and more work now within this in more broadly evidence synthesis. We understand the importance and the power of evidence synthesis and how it could potentially shape the everyday experiences of the individual. From us, the primary researchers, getting that evidence to us, synthesizing that evidence to it being implemented to a clinician, and then to the pathway of someone experiencing the care that comes from that evidence synthesis is incredibly powerful. So for my thinking, why are we not, or why and should we include stakeholders from the very beginning? And that could also be within evidence synthesis as well. Okay, so hopefully you can see this first slide, and this is a Slido slide. So I was just wondering if you can use the QR code, or you can join at slido.com with the number 322547. And I want you to tell me who you think who is a stakeholder. If you were going to have a stakeholder, who is a stakeholder? We're getting a lot of responses in. This is a little bit exciting. This is developing a word cloud. So hopefully, yep, you can see we're seeing a lot of patients. So a lot of people saying that. I think you can put in a lot more than one answer. I've tried to make it do that. So Andrea, what are you thinking so far?
Well, I'm just really excited to see patients as the highest frequency stakeholder right now. That's really exciting to me, because oftentimes we think of clinicians or healthcare providers, and we often don't think about the patient as being a stakeholder. So really, really fantastic to see that.
Yeah, I agree. I like how a person with an interest, motivation, need, we're seeing a lot of people with an interest in the work, motivation. How do you feel about the interest side of things, Andrea?
So you mean anyone who would be interested in that?
Yeah.
Is that what that helps? Yeah, absolutely. I agree. I think, consumers, healthcare providers, policymakers, researchers, the team, like I saw a couple people mentioning the team, people saying anyone really. Yeah. So I like that, to see how broad people are answering this question.
Yeah, and I'm loving how much we're getting. This has worked out a lot better than I thought it would. Yes. So as we're seeing here, and we're seeing it constantly change and evolve as we're putting everyone we can see, the stakeholder can be absolutely anyone. So Andrew, did you want to do this definition of stakeholder here?
Yeah, absolutely. So we use this definition that was published in the literature, and Danielle has included the references. So for people who are incredibly interested, you could look up the papers and definitely check out what we're referencing here. So the definition was: a stakeholder is a person or group with a vested interest in a particular clinical decision and the evidence that supports that decision. So if we see all the different examples here that we have of stakeholders, it just shows how brilliant all you folks from JBI are, because I think you've captured every single one in our Slido exercise. So well done, everyone.
Yeah, it's I think when we're thinking of stakeholders, just being incredibly inclusive of the term and seeing that it's not just us as researchers or who we immediately think it has an impact on, but it's kind of, if you think about the JBI ripple effect, the stakeholder is within that ripple. And I and Andrea are really interested in knowing if you have used stakeholders in the conduct of systematic reviews. So this is specific to systematic reviews only. And number two, do you think stakeholder engagement in evidence synthesis should be a necessary component? So that could be any evidence synthesis. And I feel because we're dealing with more Canada, America, we might get a lot more yeses in this regard, because I know it's a big push over there, which I learn off you guys, so thank you so much. So we've got 20 till 45. Hopefully we can get a few more people before we close it off, but the results are definitely looking interesting, especially number 2. Okay, I'm going to give it a few more seconds, and I'm going to end the poll here and then launch the results. So I'm going to share those results to everyone else. And I think this is really interesting. You know, have you used stakeholders in the conduct of a systematic review? We've had 20 out of 29 people actually say yes, which is, I think, fabulous, don't you, Andrea?
Yeah, absolutely. I mean, of course, I have a vested interest in this, so I'm very pleased to see that so many people have had experience involving stakeholders in systematic reviews. And I think the way that JBI has designed the reviews so that they're going to be important for clinical decision making and perhaps other types of decision making, it just shows that that's what the teams are following, and so quite a few people have experience with that.
Yeah, I agree. And I think the second question is really interesting. You know, do you think stakeholder engagement in evidence synthesis should be a necessary component? And it's a bit more of a 66 is a yes, which is great for us who have a vested interest in stakeholder engagement. But 34% say no. So I would love for you in the chat, whilst we go through this presentation and at the end of our sessions, our content session, so to speak, we can look through your experiences of using stakeholders, but we can also read out your experiences of why you might not think that it is a necessary component. So please put those in the chat, and Andrea is going to go into more the theory and the content side of this presentation on systematic reviews. Okay,
great, and just to say there were some great reasons in the chat box, Danielle. Excellent. So when we're talking about stakeholder engagement, so we want this to be bi-directional. So we don't want this to be one way, right? We don't want it just to be the researchers talking to the stakeholders. We want an interaction where it's bi-directional. And also that we want to make sure that the results of our research is being informed, is actually informing our decision makers. So this could be about the prioritization of the topic itself. It could be also the prioritization of outcomes or maybe patient populations or subgroups that we want to look at as an example. And then also this is related to the conduct and the use of research. So just I think the most important thing here is that when we think about stakeholder engagement, it really is a two-way street. And though, excuse me, some of the benefits that people have mentioned in the literature on stakeholder engagement would be less research waste because we have increased community relevance, potentially the increase of transparency and rigor because we're working with stakeholders and perhaps they're helping us move towards that. It can also help with contextualizing your findings. So we have people who are experts, perhaps it's patient partners with lived experience. So it's always great to ask them, oh, what's your interpretation of the results? And they can help contextualize those findings for you. It's hoped that we will enhance the value and impact of our research when we engage with our stakeholders. And then also to improve the implementation and dissemination of our findings. So several benefits to doing this. However, we have to be balanced in our view as knowledge synthesis methodologists, as many of us are. So we also have to present some of the cons. So it does take more time. We also have to provide support and guidance for stakeholders, and there's also some financial implications. So especially if you are working with patient partners, we have to provide them, show our appreciation, and most of the national funding agencies for research recommend that we provide them with some financial compensation. When we're working with our patient partners, even with some of our policymakers, we may have to provide them with a small stipend to help them for showing our appreciation and also for their time. So there are some financial implications of this as well. So definitely you have to weigh the benefits and the challenges whenever you're thinking about engaging stakeholders in your project. So this is very Canadian terminology, which I know that Ian Graham has probably talked a lot with many of you about. But in Canada, we've kind of divided the field into two types of knowledge translation. So we have integrated knowledge translation. This is where our knowledge users, again, very Canadian language, but we could call them stakeholders in the broadest sense. So this is when your stakeholders are engaged throughout the research process. And with this, we're really trying to work towards co-creation. So this is when your stakeholder becomes an equal member of the research team. So that's actually the ultimate goal for integrated knowledge translation, is co-creation with your stakeholders. And then we also have end of grant knowledge translation, which many people would be aware of, where basically you finish your project and then you publish it or you present it at a conference. And basically we need both types of engagement, you know, when we are thinking about our research. And so we have this active framework. And so this is thinking about the level of engagement. So if we think about this from a systematic review perspective at the moment, so we would have the leading aspect or the leading level. So this would be when the stakeholder makes key decisions about the review. So as an example, for one of our initiatives, we actually have these patient co-led projects. So patients come up with a topic for a knowledge synthesis. So let's say a scoping review or a systematic review, and then that patient partner co-leads the project. And so they're involved with every step along the way. And sometimes they even help with screening and data abstraction. They get right in there. So that would be an example of leading. And then controlling, an example of that would be developing or defining the inclusion criteria. So oftentimes we would circulate, you know, what we've drafted to our stakeholders and ask them to refine it, or ask them, we could even ask them to develop it actually, so that we know exactly what they're looking for to include. Influencing would be assisting with data extraction or searching. So one thing would be potentially asking our stakeholders for what we call seed papers. So those seed papers are papers that they know should be included. So we can do a couple things with those. We could actually develop our literature search around those seed papers, or we could use those seed papers to test our literature search, et cetera, et cetera. So that would be an example of the influencing level. And then contributing level, so that would be to help prioritize different outcomes that we're planning to abstract, or it could also be helping prioritize which research priorities we should focus on, or what subgroups that would be considered contributing. And then receiving is kind of that end of grant KT that we talked about, where you're listening to the results of the review. And then again, you know, it's just helpful to use a variety of approaches. And there's no rules here about, you know, that, oh, if you do this, it's more meaningful. It's just, these are different different levels and different options that you can use for engagement. So if you're planning for stakeholder engagement, these are a bunch of ideas and questions or tips to guide you. So think about, why do you want to engage them? So is it because you want them, so do you want them to provide feedback on your research question? Do you want them to help identify some seed papers? Do you want them to help with outcome selection? So think about the reason behind including them, because that will allow you to think about how you can do that in terms of the process. And then also think about who those appropriate stakeholders are, and how will you find them, and how will you enroll them or recruit them in becoming part of this project, right? So sometimes, with some of our stakeholders in Canada, they'll say, okay, I'll be involved, but I need results next month. So we've had that kind of thing before, or yeah, I'll be involved, but can you give a webinar to my staff on how to do a scoping review? So there's actually sometimes an exchange of favors between the researchers and stakeholders. So just to be aware of that. And ideally, this is all about relationship building. So ideally you want to have some relationships before you start the project. You already have some mutual trust and mutual respect, and it just makes the process flow easier. And then there's all kinds of things that you can do, like you can work together to develop stakeholder engagement policies. You could think about things such as remuneration, authorship, etc. So there's all kinds of different issues to think through. And Danielle, I apologize because this last point is cut off on my screen.
It just says the prioritization of the research is in that initial planning stage as well. I think, when we work with stakeholders, it can generate quite a lot of engagement and initial excitement, and so a lot of wants to be achieved. So at this stage is that prioritization and understanding of resources to that prioritization of the research question as well.
Great, thank you. Okay, so if we're thinking about integrated knowledge translation throughout the review life cycle, excuse me, again, remember we're trying to go towards co-creation. So if this was what you were aiming for, you would have your stakeholders help refine the question, define the eligibility criteria, even help you select what method. So oftentimes, something simple when people are trying to decide between a systematic review and a scoping review, which happens all the time, I usually ask my stakeholder, do you want an answer? So do you want to know if this program or this intervention works? If yes, do a systematic review. If you want to know what literature exists on that program or intervention or what has been done before, then you should do a scoping review. So you would work together with them to decide what method would be most useful and relevant to their decision-making needs. When it comes to identifying studies, you could help them refining terms, supplementing the search results. Do they know of relevant studies? Can they contact other people who may have other relevant studies for the review? We could get their input on screening, so the study selection eligibility criteria or the screening questionnaire. Also on the data abstraction form to make sure we're abstracting the correct data. Also what types of tools. So one thing is that, sometimes our stakeholders ask for grade. They want certainty of evidence. Sometimes they don't. So sometimes they want, things, some of the risk of bias results put into specific templates or specific tables or specific figures. So getting their input on that. And then also getting their input on the analysis, the interpretation, helping to contextualize the findings, and also crafting conclusions and key messages. And we often will write a one-page brief, so we could tailor it. We could do a lay summary for our patient partners, or we would do a policy brief for our policymakers as examples. So we would customize that one-pager according to our stakeholder needs. So when should we engage? So again, very Canadian, because this is what I know best. So CIHR, our national funding body, so they're they recommend that at the minimum, we need to engage stakeholders at the research question stage, when we're interpreting the data and crafting the messages and sharing of results. And just to note that we did a scoping review of how to engage policymakers in the knowledge synthesis process. And this was commissioned by the World Health Organization, and we published that a few years ago. And basically what we found was that 50% of the papers reporting engaging stakeholders in 2 or more stages. So at least half of them, and we haven't updated that, but it would be interesting to see how those results compare now. Excuse me, and then how can we engage with them? There's many different ways. You know, we can have phone calls, we could do surveys, document sharing, workshops, educational rounds. Delphi is sometimes how we engage with our stakeholders. The most common, I would say, is just traditional email and Zoom now. Everything is Zoom or Teams, which I hate Microsoft Teams. So it would be either, you know, one of those would be the most common. But again, we cover this in our scoping review that we published on engaging policymakers. Oh, and then just to note that, you know, we have been trying to advance the science of this. So we've been, we did publish a systematic review, and we actually evaluated the stakeholder engagement, and then also that we are developing a revised knowledge user engagement tool that's a bit broader than patients. So just to let you know, more work to be done in the area, and look out, because we will be continuing working in this area.
Thank you, Andrea, and you're completely right. This is a very interesting, nuanced area that has a lot of work to go. And I think, you know, throughout this, we're just trying to engage JBI and go, how can we as JBI do this, and how can we ensure that we are better at it? So this is why we think the best time for us to discuss this is during this meeting, when we've got the experts in this field all on board. So I'm going to now move to scoping reviews. Now, you've heard a lot about systematic reviews, and I think it makes utter sense to have stakeholder engagements in systematic reviews, specifically those that have had a lived experience. And that is, again, because, you know, the effectiveness, feasibility, appropriateness, meaningfulness, and experience and is directly relevant to those patients. But let's now strip it back to scoping reviews, and scoping reviews have a different sort of question. They're not asking about the FAME approach, really. They're asking more about what is out there. They might be asking about characteristics, concepts, and where are the knowledge gaps, for example. Now, they might not initially seem relevant, especially to patients. But as we saw in the first slide, and with your wonderful word cloud that you all generated for us, the stakeholder is not just about patients. So it is also about researchers, policymakers, decision makers, and it's quite broad. But because we are not making, essentially with a scoping review, concrete recommendations for policy practice, for example, should we still need to engage with scoping stakeholders in a scoping review? So I'm going to put up another poll for us all, and I'm interested in your opinions. So can we include, I'm going to go, should we include, probably should have worded that a little bit better. I do love seeing the bars just change every second to reflect the responses. Oddly satisfying. We're nearly there. I'll just give a few more seconds, and then I'll stop, and then I'll end the poll there. Okay, I'm going to end the poll, and I'm going to share the results. Now, Andrea, we've got 59% that say yes, we should include stakeholders in the conduct of scoping reviews. We've got 2 that say no, and 9 that are unsure. And I just saw in the chat by Loma Linda, health that if you can do it in a systematic review, you can do it for a scoping review. And I want to put that on a shirt. I think that's a really good way of describing it. So thank you. So the JBI Scoping Review Methodology Group has been working really hard lately on talking about stakeholder engagement, specifically for scoping review, as we did identify a gap in the evidence, because a lot of it had been broadly talking about the systematic review process. Now, although scoping review process is very similar to a systematic review, there are slight nuances and differences and issues that we needed to discuss. We can happily say that that paper is now with JBI evidence synthesis. Yay. It was a long piece of work, so I'm glad that it is off my plate to the review people. Hopefully they are kind. And so hopefully within next year, we'll be able to present some guidance on this specifically as well. So, as I said, stakeholder consultation is often limited or really omitted in the conduct of a scoping review. Now, if we look at previous guidance, we're looking at ARCSIO, MALI, LAVAC, and even our own JBI guidance, we've stated this term consultation, but we actually haven't been clear what we mean by consultation here. And JBI guidance is really something that has said that consultation should occur throughout the process, but we're trying to aim to produce specific guidance. ARCSI and LAVAC, ARCSI was an optional process for them, and LAVAC did reiterate the importance of consultation. Again, no guidance on what they mean about consultation here. And as I've said, who is engaged in the scoping review, who is the actual stakeholder in the scoping review may actually look different than those that are engaged in the systematic review, or they can look the same. So we're producing some guidance on this, and this is just a bit of a first look. So we're working to align ourselves with the work that's previously out here. We're not here to reinvent the wheel. We're here to apply it in a different context to produce more understanding. We understand that scoping reviews are an incredibly popular form of evidence synthesis. The rate of them producing is astronomical. And so we are here to say, well, we want to align it with a consultation approach to a co-creation approach that Andrea spoke about within systematic reviews. So ultimately, we would get the stakeholders to lead and create this research from the very beginning, become equal authors on this process to the end of the scoping review process as well. So what does that look like? I created this pretty cool slide. I'm very happy with it, considering I'm not a graphic designer. So we've got pre-planning, and this pre-planning stage, just like Andrea said in the preparation stage, you need to plan for your stakeholder engagement. It shouldn't just be do we need to get a stakeholder involved? It should be an active thought process, because this is pre-planning. This development of stakeholder relationships is very, very important, especially if we are dealing with a lot of at-risk populations. If you are going to experience, if those with lived experience, then we need to ensure that there is a strong relationship there. We need to then, after you've developed those relationships, and that includes the recruiting, and for some communities, it could be a very long process of developing trust with you as a researcher. It could also then go to the pre-planning and the conceptualization of the review. So this is where you're prioritizing these research questions. A lot of my work is with bereaved parents after stillbirth, and I know how excited they get when it comes to research. And so if I went into a room with a group of bereaved parents, I could come out with about 60, 70 ideas of research that needs to be conducted, or outcomes that actually do need to be looked at. That's not feasible. So we need to then go, how can we do that prioritization, and what is that prioritization process? We then to move to our specific JBI scoping review guidance, so protocol development here. And this aligns directly with the work that we have done in our guidance. So defining and aligning the objectives, the questions, the inclusion criteria, and defining the planned approach. And within that, that's where the protocol stage and the reading of the protocol can be really important. And then we move on to the conduct of the scoping review, and this is again broken down by JBI guidance. But something we can't forget is after the scoping review here, and that's dissemination of research findings. I find that you have engaged stakeholders in your research work. They are your best advocates. They will take your paper, and this is from experiences just in primary research as well. They will take your paper and they will advocate for you, and they will be your best promoters of the work. They play a huge role in the dissemination of research findings. So it's not just a piece of paper that's on a database. It's an important piece of work that is actively getting to the community of need. And so it has a lot of importance this after the scoping review, even after any review process. We can't forget the importance of not going, this is done now, it's finalized, it's published. We need to actively go, well, what after now? What can we do to ensure that this is getting out to the very people that need it? So I'm just going to break down the two specific processes here that haven't been covered by Andrea, as Andrea focused on systematic reviews. As we said, this is a very similar to systematic reviews. There isn't much difference. I guess the only change here is we don't really do critical appraisal and scoping reviews. But what we will see is a very extensive searching process. We may get resources, especially if you're, say, looking at what are the resources available to certain populations. They may be actively collecting the work for you, especially grey literature. And so this can be a really long stage, but also a really good stage because you're getting information that you might not be able to find on typical databases. You can actively ask if stakeholders want to take an active role in screening, selecting and extracting results, but also to check the results if they make sense. And I get that the phrase makes sense is not very academic, but at this moment, it's the best way I can describe that process of being able to look at the results and go, especially when we're identifying knowledge gaps in scoping reviews and going, well, how have we not looked at this already? This seems really important as a stakeholder that should be looked at. Why hasn't that been looked at? And so this is a really good time to be able to talk about the potential knowledge gaps. And as I said, they can help develop or review the implications of findings to ensure that they are meaningful to the community as well. And that could also be the community of researchers, because they themselves can be stakeholders here. We could develop evidence summaries, not the typical evidence summaries we see from systematic reviews, obviously, which recommends policy practice, but more an overview, a lay summary of what was found within the scoping review. Things like science communication strategies could be developed with stakeholders about the paper and the work, and that could be put on Facebook, Twitter, for example. And of course, I'm a huge advocate that we as researchers are advocates for the work that we do and that we achieve, so it can be shared to community and relevant organisations that could benefit from it. There are considerations though, and I'm seeing in the chat lots and lots of questions and considerations, and that's amazing. And again, it speaks of the fact that this is a complex discussion, and it's going to be very nuanced for the discussion for the individual research question and research team. I'm going to throw a bit of something into the, I don't know how that's Santa into the woods, I think that's the expression, and to ask about, do we need ethical approval for the inclusion of stakeholders with lived experience, so we're talking more about patients here, in reviews? Because theoretically, ethics needs to be sought for any time we collect data of individuals. And those that have a lived experience may need to be protected by the rules of our ethics committee. Now, the general consensus, and I've put this out a few times on Twitter and just general chats, is no, we don't do ethics for reviews. Don't add another process, please, to the review process. It's big enough. Don't do it. And I get it. But it's something that you may, as an individual organisation, may need to look at. because evidence synthesis is research in itself. And if you are actively collecting, especially information of people, you may need to actually meet the rules of ethics. There is no guidance on this. Don't worry, we're not asking you to do ethics for a review. It's just something I'm planting a seed for you to maybe investigate further for your organization. The other issue we have is stakeholder engagement and reporting. It's not actually included in the PRISMA SCR, which is our preferred reporting standards for extension and scoping reviews. So we don't have guidance on how to report stakeholder engagement, what we need to include. There is the GRIP 2 reporting standards that could potentially help influence us as we talk about how we report stakeholder engagement in the protocol and in the manuscript. But again, there's no clear guidance on that. And also we've got evaluation. And Andrea and I both believe that we should reflect on this process of including stakeholders. Ultimately, we don't want to say, yes, we definitely include stakeholders, but it's tokenistic. And we are not reflecting on that process and that inclusion. We want to say, yes, we include stakeholders and we've evaluated that and we know that we are doing it correctly and that it is meaningful for both the stakeholder, and that could again be other researchers and research and us as a research team as well. So another thing to end on is remuneration, which I understand is a huge barrier. Sometimes a lot of us researchers are not working with any money at all. And that can be difficult when we want to include stakeholders. That's why grants are now putting in that you put, if you are using stakeholder engagement, and the cost of that to ensure that they are appropriately remunerated. But that is something that you need to consider here. You should, at the start of the process, ask about what they want or need and don't assume what stakeholders want or need. And this, again, could be other researchers' time. We need to value our own community in itself, don't we? So we need to ask, is this a financial, an authorship, especially if they meet the criteria for authorship, or is this an acknowledgement? Make clear guidance from the very start to hopefully avoid complications at the end. And some final tips is that us as researchers should engage in training on how to engage and include stakeholders within research projects. And that includes communication strategies to really ensure a very cohesive team environment. We're not maybe necessarily working with just researchers and how we speak about in traditional research ways. We might be including those that have lived experience, and we need to be considerate of that. We need to ensure that we will have appropriate resources to be able to engage with stakeholders, and that includes adequate staff, finances, and training, and ensure that if stakeholders want to have an active involvement, that they themselves have a computer and adequate software as well. Consider any potential barriers, and that could be accessibility and challenges surrounding digital literacy, transportation costs, accessibility of meeting notes. So a team member of ours from the methodology group were working with an older population, and they wanted a hard copy of the meeting notes, and they wanted that hard copy to be in a larger print. So think of these issues and potentially future-proof any potential issues for including stakeholders. And of course, be positive, create a positive environment, be genuine, curious, realize that this process is a process where you will learn as well, and open to experiences and ideas, and acknowledge the contributions of others. So we're going to go back to Slido again. This may be my very favorite program right now. And I want you to go, what are the barriers and the facilitators to including stakeholders in evidence synthesis? And this will create a word cloud, but it was probably the best way to actually generate, but I don't know if it'll actually generate a good word cloud. So we've got time, excellent. Anyone else? Just throw in any potential issues you could have. Envisioned issues, doesn't have to be issues that you've had previously. Yeah. Funding, I can definitely see that that's an issue. experience, contact issues, recruitment. Andrea, how are you feeling about all these wonderful responses?
Yeah, I mean, we've done some barriers. We've published a paper, not to give it away, on this that you could look up right now and get some of these from, but given how fast these are coming in, I know these are people's honest gut reactions. So again, showing the brilliance of the JBI, and these are all, you know, like funding and time and power dynamics and experience and recruitment and, you know, all of these issues would all, it could be a barrier or it could be a facilitator. Yeah.
Yeah, I think this is absolutely a wonderful word cloud. Might be the best I've ever seen. And I'm really happy to see all of these, because we're not here to say that we're going to be able to solve all the solutions. This is the very start of our journey, and this, by collecting this information, will help us be able to go, well, what can we do to think of these solutions? And this is at the starting point. So thank you so much for doing that. Access to summary, you know, appropriate connections, all very, very relevant, not just theoretical but practical stuff as well. So thank you. So I'm going to ask one final question. What can or should JBI do to promote stakeholder engagement? And this is an open text response, so feel free to put in, no, don't do it. Don't do stakeholder engagement if you feel like that. We'll only be slightly crushed if you do that. But write in what you need from us at JBI. What can we do to improve? So we've got the first one is leave it flexible. Guidance or case studies, access to summary, build it into the process and make it easy. Don't do it, don't mandate. Fair enough. A lot of summary coming up, provide best practice, flexibility. And this is fantastic to start off with, because it shows us what people are wanting. Okay, so that is the end of our presentation. And Zoe, I'm actually not sure if I went over time. I don't think I did.
Only just by the smallest fraction, but well done. That was such a good session. Thank you, both Andrea and Danielle. I really enjoyed that. Stakeholder engagement is something that's been around the periphery in JBI for a very, very long time. And I think it often gets put in the too hard basket. I'm really fascinated to see how this work goes forward. And I think there were some really useful comments in the chat that we can use. And even some of the comments here, I think, are really useful. I love the idea of a toolkit or something that can help to support people, but that's not necessarily mandated. And this is something that I had quite a lot of involvement in when I first started in JBI about 20 years ago. So I certainly have an appreciation of the complexity, but I'm really happy to see that it's back on the table, and would love to see how we can take something forward to support our people doing reviews.